contagious when they're asymptomatic?
Sure.
So, as if the available data we have from the CDC, the infectiousness period, or how contagious is the patient, it is usually between 2 to 14 days after exposure. They don't have exact time because a lot of this information, we are learning it as we go, basically. But they found out from a recent study that was released in Germany also, that the virus will be shedding excessively in the first week to 10 days from exposure. And therefore, you see a lot of these quarantine cases that we hear of in the cruise ships and in other exposure cases. The 14-day of a quarantine is essential because this is the time where the patient is most infectious.
And they're contagious while being asymptomatic?
Well, yes. So they can shed the virus without being symptomatic, as Dr. Tomateski was saying. This virus is like any other respiratory viruses that's out there. It is contagious and it can eventually affect a lot of people. At least as if now in our community we don't have what we call in-community transmission. That's what the criteria they were talking about, who's going to be checked and evaluated for that. It's not going to be everybody that walks in, because we do have some limitation on who to test.
And there was another question, yes, sir?
Yeah, the preceding physician mentioned or used the word contain. So at what point would you recommend that local schools prevent mass gatherings such as basketball games and assemblies? And is there any criteria for that, and even potentially a school closure?
So this was talked on by the vice president group, to the governor of the state, to Dr. Fauci, who's the head of the NIH. Every community have to determine this issue on their own, depending on the number of the cases. We cannot do a cookie cutter approach here, because we cannot close the school and close the events unless there is a certain number of cases. It is to be determined by the policymaker and by public health department in consultation with the local health authority what to do with that. Therefore, it is not going to be automatic things. There is some recommendation also from the CDC about how school and university dealing with this issue.
I just want to add to that last question. We, as you all know, we're going to be working very closely and continue to work very closely with the, not just the local health authority, but also with the county public health, to make sure that if we announce anything of such, or we see increased numbers, they're going to know as well as we. So there are going to be a lot of communications on whether or not this is taking a hold in the community. The point that I'd like to emphasize now more than any is that please don't listen to all the rumors. This morning I was told by a 14-year-old from one of the schools that results are out, and she had the results before us. That's not an appropriate thing. Let us share with you the results. Please don't listen to anything on social media that's not put out either by the Centers for Disease Control, by the, again, county public health officials, because these are rumors or stories or what have you. Let us share with you what we know so that you're assured that what you're hearing from us is something that we really know. So the results that we heard this morning are not the results. We will share with you the results as soon as they become available. Any other questions? Yes, ma'am. As of now, it's inconclusive. It's, again, I'll repeat what Dr. T was saying. Samples have to go back to the Centers for Disease Control tomorrow morning. The second sample will be heading out to San Diego, so there'll be multiple samples that are on their way to those labs. Once we get those, I assure you, we will make sure that you get the word and we share that with the community. Yes, sir.
Is there a time estimate from today for when those samples will be available?
It's back to what Dr. Al-Jazim and Tomacheski were saying. It's 24 to 48 hours. So I can't give you an exact time, because we were actually like on the last minute trying to get the first wave of samples in. So let's wait until they give us a little bit more estimate, and make sure that you stay in touch with us. We'll make sure that we send out information about as a third gathering or a fourth gathering to discuss the results. So with oh, yes sir.
Just so that I understand.
Sure.
In the meantime, until we receive results and until we get information from the public health department to review, it's okay for schools to continue to have mass gatherings at basketball games, assemblies, track meets. Is that what I understand?
That's their call, not ours. Again, we're hearing, for example, that March Madness might actually have games without folks in the stands. So we don't know. That's their call, not ours. We don't have anything that would worry the public right now, because we don't have any results that will make you worry to the point that you are canceling any events. But again, we will turn that. I'm sorry. Go ahead. Yes, please.
So, the limitation that presented by the CDC about, for example, the elderly not to be in a crowded place, in a crowded airplane, or going to a cruise ship, especially if they have some underlying medical condition. It's true, and I understand the public concern about the mass gathering and the school and the sports events. The issue with that is always we have to continue to educate ourselves and our children and students about the hand washing, the social distancing. Somebody sick should not be going to school, should have a mask on, should be at home and going to the healthcare provider.
So I'm going to turn it over for closing remarks from the mayor.
Any additional questions from the public? Thank you, Dr. Edwards. Thank you, council members, for joining me today, Patricia. Thank you. We just want to assure the community that both the city and the hospital are doing everything they can to monitor the situation and be able to address this in a manner that protects our community. As you may be aware, at the state, local, and county level, there's emergency declarations that have been approved, which will afford the cities additional resources from the state. And this is a very serious matter. I think that we have the team to be able to address this. Again, I want to emphasize for our community to be assured that we have the best health professionals, the best health facility to be able to address this. And please don't panic. That was, again, I'm concerned that some of our citizens are viewing this in a different manner, and I felt it was our responsibility to share this with you. We will release the report as soon as they're back for conclusive assessment of the patient, but as Dr. Tomaszewski indicated, I think it's a matter of time before we do have a coronavirus case in El Centro or Imperial Valley and Mexicali and other parts of Mexico, and we'll be working closely together with all the appropriate agencies and responsible parties to make sure that our community is well protected. So with that, we'll conclude our press conference, and thank you so much for joining us today.